Finding new ways to deliver care and support health and well-being is key to keeping people well. Lancashire Care NHS Foundation Trust is looking at new and innovative approaches to educate people and deliver services in the local community. Jonathan Gibson went to find out about these initiatives and to see how they're making a difference.
They called me fat, they called me thick, they told me that I was never going to amount to anything.
Sam wasn't much older than these Year 9 students when he began suffering from depression and anxiety.
My Instagram never used to be how I really was. I used to post that I was happy, I used to post that my life was perfect, but actually behind the screen was a guy that didn't care if he died.
Sam's upfront, honest approach to mental health draws on his own experiences to reach out to young people.
I know the pressures that you guys are feeling.
Change Talks is a 6-week programme he's devised for schools in partnership with Lancashire Care NHS Foundation Trust.
This session is really my lived experience story, so I'll share with them the things I've been through, and then I'll go on to sort of different topics of mental health, so I'll touch on depression, anxiety. I'm going to be talking about self-harm, why the young people do it, and then social media and drugs.
For us as a school, we really wanted to bring Sam in to raise the profile of talking about mental health, and as a young man who's experienced mental health difficulties himself, it's important for us to get the young people to see that it's okay to talk about it, and talking about it breeds resilience. It's trying to be proactive in order to reach our young people before they get the need to go to other services such as the NHS or CAMS. If we can build up resilience and proactive approaches within schools, it just means our young people are equipped to be able to manage their own mental health in the future.
Vincent, Robert and Hannah have all completed the course.
What did you think of it?
We generally hear about mental health and the effects of it on people in our generation, but we don't really hear like the specifics of and examples like Sam gave. So it's really helpful to have those specifics on what it can actually do.
We could relate to him, so it was easier to talk to him.
And is that relatability important?
Well, to echo what these were saying, actually, having someone who's not a teacher is quite a beneficial thing, because it creates a much more sort of personal environment.
Creating the right environment for people to discuss their concerns is at the heart of Lancashire Care's strategy for promoting mental wellness. It's one of the reasons it's invested in this vehicle, to make access to help that much easier.
It provides a real opportunity for us to do two things. Firstly, go out into communities and ask the question about how can we best shape our services to support your community? How can we best support you as an individual? And then secondly, when we're having those conversations, if people want some signposting, some immediate advice, that's great, we can deliver that as well. The world around us is changing really quickly, and I think that we need to be thinking about how do we shape all our services, both those services around early intervention and our acute responses. We really want to try and break down some of the barriers and separations between mental health and physical health.
My Place is another of the projects the Trust supports in conjunction with the Lancashire Wildlife Trust.
What we've done is set up a series of ecotherapy workshops that run across the county that mental health professionals can refer into us, and we'll offer a non-clinical support option for people.
Theo turned to My Place after trying to kill himself.
It just absolutely changed everything, just everything about it, just socialising with people. I don't think I'd be here without My Place, knowing that there's so much more to life than just feeling down.
A message echoed time and time again.
It's had a really big positive impact on my life.
I can't describe enough how much it's helped me over these past 18 months.
It's nice to know that I'm not the only person going through stuff.
I think it's understanding that mental health is something that everybody, and wellbeing is something that everybody can have challenges with at some point in their lives, and it's about kind of building up people's resilience.
And so whether it's Change Talks in the classroom to My Place here in the forest, very different schemes, yes, but with a common purpose: to promote wellness. Schemes that are making a positive difference to lives right across Lancashire.